Good afternoon. I'm Dr. McLean, a radiologist for the clinic system. I'd like to welcome everybody here to Palmer College of Chiropractic, and thanks for joining us for this induction. I guess on a personal note, also I'd like to welcome my son Alex, just to embarrass him as well. This ceremony signifies the hard work and dedication our students have done during their preclinical chiropractic academic coursework. Today we welcome you to the clinical education portion of your time here at Palmer. Your mentors, right there, please stand. These doctors of chiropractic are here to guide you. Thank you for that welcome. You may see these doctors of chiropractic are here to guide you through your clinical education and to prepare you for your future in our profession. Listen to them well. This is a great source for you. We look forward to watching you progress. It is my honor now to welcome to the podium Dr. Amberly Ferguson, one of our faculty mentors and members. Dr. Ferguson, apparently very popular, assistant professor at Palmer. She graduated from the University of Northern Iowa in 2003 and earned her Doctor of Chiropractic at Palmer in 2007. Following graduation, she moved to Minnesota, where she practiced as an associate at 2 clinics in the Twin City area. In 2012, Dr. Ferguson accepted a position at Rasmussen College teaching for the Department of Health Sciences. In 2019, she was ready for a change, and so in 2020, she joined the Life Sciences program here at Palmer, teaching endocrinology, systems pathology 2, and physiology 3. Such important, great topics. Amberly and her husband Mike live in Davenport with their cat. I'm not so sure about that. And they enjoy traveling and being outdoors. Thank you for being here.
All right, you guys. When Dr. Kara Shannon emailed me about doing this speech, they gave me a timeline of 5 to 7 minutes. And you guys know how fast I can talk, right? So I can do this in like 3. I'm just kidding. I'm just kidding. I'll slow it down. All right, so first of all, welcome class 262. I'm so proud to be speaking at your clinic induction ceremony. Congratulations. I would first like to thank all the family and friends, faculty and staff who are here today to celebrate these 68 amazing students and recognizing all the hard work it has taken to get to this moment. And that's exactly what this is, a moment. Did you know that one of the most exciting and scariest moments of a parent's life is their child's first day of school? Watching that school bus drive away from the bus stop, or dropping them off at school for the very first time and having to just drive away. Now, I personally do not have children, so I am assuming this is a very exciting and scary moment. Excited about all the new things their child is going to learn and experience, and all the people they will meet. But unsure and anxious about that everything's going to be just fine. Trusting they will be safe and taken care of, and that all the things you've taught them so far is enough. Well, class 262, my colleagues and I can relate to these feelings. You are leaving us, your home, your nest on the west side of Brady, and you're heading somewhere new. We are excited about all the things you are going to experience and learn and people you will meet. We do know that everything will be just fine. You know where to go, and when you get there, you have amazing staff docs to guide you. And yes, everything we've taught you so far is enough at this moment. You are about to enter your clinical experience here at Palmer College. And you're going to start seeing patients. I am guessing you are probably feeling excited and scared. I know I was. Think about it. When we think about moments in our life, big moments in our life, these two emotions are often expressed. Like that first day of school, during a sporting competition, traveling abroad, starting college, dating, graduating, starting or joining a business, getting married, having a baby. Life is both exciting and scary. Clinic is going to be both exciting and scary. There are going to be moments that you feel more excited than scared, so embrace those moments. Feeling excited is magnetic and infectious, so share your excitement with each other. There are going to be moments that you feel more scared than excited. That's okay. Feeling scared shows vulnerability and humility, so be brave enough to share those moments too. Remember, clinic is not a competition. However, you will get out what you put into it. It's an opportunity to be somewhere new, to grow and learn and practice the art of chiropractic. I hope that you are truly excited. When you are going into the clinic, to make your transition a little less scary, I've taken the liberty of asking your staff docs what qualities they think successful chiropractic interns possess. Here are some of their responses. Self-initiation, yet remain coachable. You have gotten to this point today, and now your learning opportunities and your growth is your responsibility. So don't forget to ask for help and mentorship, because no matter what you know or what you've done, we all have room to grow. A desire to learn as much as you can and drive to do your best work, and the ability to pivot when needed. Be open-minded and adaptable. Clinical practice is not always black and white. Think critically, but be forgiving of yourself as you continue to connect the dots. Be humble and receptive to receiving feedback and constructive criticism, and have the ability to self-reflect on it. True care and concern for your patients and their autonomy. An attitude of positivity and professionalism. Be compassionate, empathetic, and have integrity. And lastly, good communication skills. Life comes down to communication. In little over a year, you'll be walking across this very stage and graduating. And that is not the time to start practicing and developing these skills. Now is that moment. According to the author Malcolm Gladwell, it takes 10,000 hours of practice to be considered a professional at a skill or career. Putting on your white coat doesn't mean the work is done. It signifies you are just getting started. So use your time in the clinic wisely. Let me ask you this. How does a baby bird know it's ready to leave its nest? And more importantly, that it can fly? I don't know either. But I'm assuming it goes something like this. It steps up, it spreads its wings, it believes, and it jumps. Now that baby bird still has a lot to learn about being a bird. People here today believe in you, but more importantly, you need to believe in you. Be that baby bird who is ready to leave the nest and fly, but also recognizes and realizes it has so much to learn. Cherish this day. You deserve it. Accept your white coat with honor and recognize what it symbolizes. The beginning of a new opportunity and the responsibility that goes with it to serve your patients. Class 262, congratulations, good luck, and thank you.
Thank you, Dr. Ferguson. Excellent insights. Your academic time at Palmer has been rigorous and will continue to be so. I welcome our Dean of Programs, Dr. Michael Tooney, to the podium to address.
All right. Thank you, Dr. Ferguson. That was excellent. I think what you get from Dr. Ferguson, especially in that talk, you get to see her passion, not just for the topics and what she teaches, but more importantly for you, for her students. So, first off, I'd like to thank all the family and friends that came here today that traveled from all over the country. Some of you, this is a nice warm day. For others, this feels really chilly. So we appreciate you coming here from no matter where you came from. Thanks for the traveling, and thanks for all the support. As Dr. McLean said, this is a challenging program, and the phone call, the dinner, the help with laundry, whatever it is, really goes a long way. And so we thank you for all of the support, for everything you bring to our students. Class 262, education is transformational. Oliver Wendell Holmes stated, "One's mind stretched by a new idea can never go back to its original dimension." You are a different person today than you are when you began your education at Palmer. This ceremony marks an important change in perspective of what matters most. Your first trimesters here, studying life sciences, diagnosis, radiology technique, the focus was on what mattered most for the quiz, the test, the practical, everything that came in front of you like that. The perspective now changes to what matters most for your patient. There will still be challenges ahead of you. Be a source of positivity for each other and for your patients as you continue learning in the clinical environment. The people with you here today, family, friends, faculty, each other, we're still here to support you in this journey. Congratulations on your induction. Good luck to you in your clinical experience. Thank you. I would now like to introduce our Associate Dean of Clinics, Dr. Kara Shannon.
Thank you, Dr. Tooney. I'm Dr. Kara Shannon, and it's really nice to see you guys here on a Friday afternoon instead of late on a Wednesday after a full day of class, right? Yeah. And no more of that, right? It's awesome. All right, so today we would like to honor and welcome the students to the next step in their chiropractic education with this induction ceremony. Students, we know you are sufficiently prepared to join us in the clinic and share your knowledge, passion, and skills with both our patients and the community. Over the next year, we will watch you transform amazingly, and we will meet back here in a little over a year for graduation. The journey that lies before you will be exciting, but again, the theme here, exciting, but maybe a little bit scary, maybe a little bit of a whirlwind. But please know that we will support you every step of the way, and we are here to help in any way that we can. The time has come to formally induct the students into the clinic, but there are some procedural items to go over first. When presented, the students will come to the side podium where they will be introduced by Ms. Tara Schultz, Executive Director of Clinic Operations. Dr. Pavlicek, my fellow Associate Dean of Clinics, will be assisting students with cloaking of their white coats, which in the healthcare field signifies purity, professionalism, and clinical knowledge. Students will then present at the center stage to meet me with their badge, which will be attached to their white coat to signify the induction into the Palmer Clinics. Students will move to the backdrop for a picture to be taken by the college photographer. And then students will then exit the stage right over here where Dr. During, Director of Rehabilitation Services, will be presenting interns with a token of our appreciation for the hard work to get here. Ms. Tara Schultz, Executive Director of Clinic Operations, please present Class 262 for their induction into clinics.
Carly Alley. Angela Bagenstos. Aiden Ballou. Marita Banta Long. Sophia Bartholomew. Nicole Beckman. Colby Benson. Jake Bonenkamp. Lydia Brown. Ron Cullis. Dennis Decker. Christopher Dobbins. Joe Dye. Justine Ecker. Lillian Ehlers. Adam Elayan. Tyler Gill. Alec Gillette. Edison Goodlow. Jill Golka. Casey Hackett. Dylan Hagan. Kira Hamill. Alonz Hollis. Sumara Howard. Kylie Howell. William Huss. Kai Curl. Jordan Knutson. Layla Lawson. Isabel Litz. Zane Luce. Paisley McConnell. Alex McLean. Ethan Merriman. Hunter Miles. Vincent Miller. Brooke Nett. Tyler Oberbrockling. Mackenzie Olheiser. Joe Olson. Alexis Ortiz Nunez. Melissa Padilla. Taylor Rankin. Jordan Reasoner. James Rivera. Elena Roth. Tiana Salanoa. Nawi Salgado. Olivia Sanders. Kyle Schiller. Jackson Schmitz. Dylan Shaner. Drew Shirkey. Hunter Schwab. David Sieber. Aaliyah Sagafis. Michaela Spang. Gabriella Staub. Jacob Steckler. Annalisa Sullivan. Ryan Sun. Justin Tonisala. Brooklyn Udelhofen. Caden Walls. Catherine Warner. Da Wei. Seth Young.
I have to say, just off of a side note, this has been a good girthy group. I like that. Thank you. Makes me feel at home. I'm Dr. Pavlicek. First and foremost, I'd like to thank the students' families and friends for being here for this important day. I know you've supported our students, whether it's a phone call with encouragement, a visit to campus, a little check here and there. It's always been greatly appreciated. As the ceremony concludes, there is a reception for everyone down one floor in the Fellows Hall where there is cake to be served, plenty of it. There will be tables set up for the Fellows Hall and the Gothic Room. Students, you'll find your staff doctors in the Gothic Room if you want to visit them with your families. Some directions, okay? A class photo will be taken directly after this ceremony, and all the pictures and recordings of the ceremony will be posted next week and are free to use. Before the picture, class 262, would you please stand up and show yourself to the congregation? Thank you. Students, you may be seated. Again, guests, we want to thank you very much for coming. You may take a couple minutes now and go down to the fellows room for the cake. The students will be coming right afterwards. For the directions, students, what I need you to do is the first 3 rows, we need to move the seats out of the way. You'll be taking a class photo up here. And after the picture's taken, there's a carnation for each student that you can take on the way out. So congratulations, class 262, or welcome to class. You all have a great day. Thank you.